name's Kaylee. I'm a nursing student from Newman. How are you doing today? Good. I have a doctor's order for an NG tube, but before we get started on that, I'm going to do a couple quick assessments. Can you first tell me your first and last name? Alright, and your birthday? Alright, and your allergies? Alright. So before we get started, have you ever had any surgeries of your throat, mouth, neck, nose? No? Okay. And I'm just going to listen to your bowel sounds real quick. Alright, those bowel sounds there's positive bowel sounds in all 4 quadrants, but they are a little hypoactive, so we're going to go ahead and get some of that suction out. Is that okay for you? Yeah? Okay. So before we get started, we're going to go ahead and hook up the suction. And make sure it works. Come back over here, do some hand hygiene. Do you have a preference which side of the nose it goes in? No? Okay. Alright, I'm just going to check patency for you. Can you take a deep breath in? Another one. Alright, we'll go ahead and go. They're both clear, but we're going to go ahead and go on that right side. Before we get started, I am going to put a towel down for you. If you do feel nauseous during any point of this, let me know. We'll go ahead and stop and give you kind of a break. Here is a basin just in case you get sick, and then we're going to simulate that this is a cup of water. So. I have all my supplies here. I have my NG tube, I have a filter, I have a little vial so I can check the pH of it. I have my pH strip lube, an extra basin, and an extra syringe just to make sure, or to check for the pH level once I get it positioned. So before I get started, I'm going to check the length of it. So we're going to measure from the tip of the nose to the back of the ear to the xiphoid process, so about 60. We're going to go ahead and mark that with a piece of tape. Alright. I'm gonna go ahead and kind of coil it up a little bit so it's a little bit easier to bend and get in there. And then I'm gonna go ahead and put some lube on it to make it easier to go down about 3 to 4 inches. Alright, once again, let me know if you feel any kind of discomfort. Here's that cup of water for you. Alright, I'm gonna go ahead and have you take a deep breath in. Alright, 1, 2, 3, we're in. Alright, now that we're a little bit in, I'm going to check in the back of the mouth. Can you say ah? All right, and I see it back there. So I'm gonna have you start taking a sip, and as you take a sip, we're gonna swallow, okay? So go ahead and take a sip, and I'm going in, maybe. Okay, take a sip, swallow, 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 and another swallow. Okay, one more big swallow. All right, one more. All right, so we are to where we are marked. So I'm gonna go ahead and tape it down to his cheek to anchor it while we check the location to make sure that it is in the stomach. So we'll go ahead and take this off. Are you still doing okay? Yeah, okay. So I'm gonna go ahead and hook this up and draw back until we start seeing fluid. All right, see some fluid. All right, gonna go ahead and unhook this. I'm gonna go ahead and put it into the canister nice and slow so it doesn't splatter out. All right. And then we'll go ahead and dip this pH strip in. And it looks like it's about a 3, in between a 3 and a 4. And that's good because we want it less than 4. But we'll go ahead and have x-ray. We'll go ahead and send them off to x-ray and make sure that it's positioned in the right spot. Okay, patient is back from x-ray. I'm gonna go ahead and take off this towel. It is positioned in the right spot, so we're gonna go ahead and hook it up to suction. And as we do that, we're gonna go ahead and hook it up to his gown as well. So we're just gonna kind of tape it to his gown. And we're also going to tape it to his nose to keep it secure. All right, and then we're gonna go ahead and turn on suction. Before we got it hooked up though, we would make sure that we're still on the right one. So we have suction. So gonna hook it up. All right, we start seeing fluids. We're gonna make sure the patient is still doing okay. Making sure they're not having any kind of adverse reactions. I'm gonna hook up the filter before we leave the room. All right, and then I'm also going to switch it over to intermittent suction and make sure that the suction is still in the green. I'm gonna go ahead and make sure I clean everything up, hand hygiene, and make sure the patient is doing okay. And I'll chart it.